Hi, welcome back. I'm Michael Stamatinos, your host with the Advancing Healthcare Innovation Show. And if you're new to us, it's great to have you here. We happen to be really passionate about healthcare innovation, adoption, and leadership and access. So if this is your first time tuning in, let me just kind of tell you a little bit about what we do here. So we're a healthcare innovation company, and we're focused on bringing stories of innovation within healthcare to life. And our aim is actually just to talk to real people that are in the trenches, making it happen day in and day out, and giving them a safe space to be able to share their stories and learnings with the world. And we've got an incredibly action-packed year. So if you haven't checked out any of our older interviews before, hit subscribe now so you get into the new ones, and then go back and you can binge watch a whole bunch of the other ones. I'm really, really excited about today's guest. We've got a very special guest today. We have Rebecca Love, who is a renowned nurse, an innovator, an author, a speaker, and she's a connector. She was the first nurse that featured on TED.com and she's a regular contributor to Forbes Business Council. And Rebecca's been a trailblazer for some time, empowering nurses as innovators and entrepreneurs. And she's founded multiple companies. She's currently the chief clinical officer of IntelyCare, where she oversees the clinical quality and excellence of over 40,000 nursing professionals. And she's just very, very world-renowned, I would just say. You're very well known, especially in the format of LinkedIn. So today we're going to be just sort of digging in and discussing Rebecca's journey in nursing, her passion for empowering nurses, and insights on how nurses can drive healthcare innovation. And we'll explore some of those challenges and opportunities in the nursing profession, and learn how Rebecca's sort of thought leadership continues to impact and motivate nurses around the world. So, Rebecca, welcome to the show.
Michael, thank you so much for having me. It's going to be so much fun. I'm looking forward to this conversation.
Yeah. So, I mean, when you want to look into the future, you first have to kind of peer into the past. When did you know that you wanted to be a nurse, and what was that sort of that evolution like as you made it into the nursing profession?
You know, Michael, I've shared this before that actually I was not necessarily excited about nursing. It wasn't my first call out. The truth is that I thought I was going off to law school until I went out to dinner with my mom. It was after, I did a degree from BU, Boston University, and international relations, a minor in Spanish, working on a presidential campaign. And I was supposed to go down to the campaign in DC with them and go into law school. And my mom sat me down at dinner one night and she said, "We have enough strong lawyers in the world, Rebecca. We don't have enough strong nurses." And that was when my life sort of changed. And I agreed to apply to one nursing school. And was told there was like this 2-year waiting list. It was going to be impossible to get in. And suddenly, a few weeks later, they sent me an acceptance letter for the fall if I could finish my prereqs. And if you're anything like me, Michael, I am one of those people who, I'm a big believer in signs. I'm one of those people that I think I'm going to go straight. And then suddenly, and people joke with me all the time, they're like, squirrel, and you go right. And for me, that was a sign. And I was supposed to do this because it just seemed too fortuitous that the stars aligned. And that's how I went into nursing, with this idea that if we could, at the time, my mom had gone back to nursing school late. She had graduated in her 50s, and said, the truth is that it's such an incredible profession, but we don't have much of a voice. So even from my earliest days of starting nursing school, I had this feeling that we had to empower this profession. And I didn't know what that was going to look like, but I lived it every single day that I practiced, feeling that struggle of the largest healthcare profession in all of healthcare, but largely hidden from so much of the decisions that were made, both for the profession and for the industry in which we lived our lives.
So do you think that your mom primed you in a sense to be that voice, or was it what was it that really unearthed this voice to really come to life? Because you have a really big platform. So I'm just sort of curious, when did you start taking that on, and when did you start really voicing this? Was this even as you were practicing, or did you one day just decide post-practice that you're going to be sort of the aficionado, the nurse sort of voice?
Oh man, I think that totally happened by accident until, but I think it all started with when I was teaching. I was a nurse practitioner. I was teaching at a community college in 2012. And what had happened was my student nurses were graduating at that time and they couldn't find jobs. This was crazy because everybody always thought there's a nursing shortage, you're always going to have jobs. But in Boston in 2012, nobody would hire associate degree nurses. And I think what happened was I literally felt their desperation. And that was when we created my first company, hirenurses.com, which was a job board for nurses. And what I realized through that experience, trying to help my students find jobs, my patients find caregivers, was that still there was this lack of understanding around why nurses should even have a job board, why they should even talk about careers, why, we should even think about different career paths. So I think I sort of fell into it because I wanted to help all of these nurses that I love who sometimes felt trapped about not being able to find jobs, and then others who felt like there was no career path outside of the bedside. And I think that's how I sort of fell into saying we had to do things differently. Starting your first company and then hackathons and everything else that came was always about the status quo was not working for the nursing profession. And I guess I just always believed, well, if it wasn't working, like that meant somebody had to fix it. And for some reason, I just always thought to myself, well, nobody else is fixing it. So I guess I'm just going to dive in and try to tackle. And that's sort of how life's happened. One problem after the next that I saw in nursing and said, okay, we're just going to do it. I think that's why just this fundamental belief that, well, you know this, you have innovators on your program and entrepreneurs.
Yeah.
And my guess is that there's a similar thread, right? They saw a problem and they didn't wait for somebody else to fix it. So they just decided to do it. And that to me is what is just inherent in the idea of the difference between innovators and entrepreneurs versus others who aren't going to take that kind of risk.
Yeah, you're being able to manage the calling and then doing it in a very pragmatic way. One of my favorite shows growing up was MacGyver, and I know that you're into MacGyver. Can you talk about a little bit about how you're MacGyvering right now in the nursing space? And let's kind of maybe fast forward a little bit to some of the things that you're doing now with IntelyCare.
Yeah, so no, IntelyCare was this amazing technical platform. I am not a founder, so I don't take any of the credit of the brilliance behind it. Our CEO is a tech founder, David Coppins, and recognized early in 2016 that we weren't optimizing a vast majority of the nursing workforce, which I don't know if you know the statistics, Michael, but like 80% of nurses, after they have their first baby, obviously women, still 95% of the nursing population is women, they go per diem. Or many nurses are part-time, but really the system is designed for full-time workers, which is sort of crazy because you've got to make some flexibility. So the idea of IntelyCare was if you took a paper process of scheduling and shifts and you put that onto a technology platform that could speed up the filling of shifts, could you scale a per diem and part-time workforce to fill in the gaps in healthcare, specifically in long-term care? And that's what IntelyCare did. And it has been shown to be tremendously effective at scaling the per diem workforce, where we are W-2 employers, but the vast majority of our workforce just picks up shifts external to their full-time job when and where they want. And it has been transformational for keeping and putting professionals into the long-term care space. I'm talking about skilled nursing rehabs and SNFs and facilities, not the acute care space where the hospitals have it, but the space where literally during the pandemic, over 400,000 caregivers left caring for our seniors because that's who lives in long-term care. And so we spend a lot of time on how do you reinvent the care delivery of nurses in long-term care, making them feel that accessing and providing care there is both beneficial for their lives and also for those that they care for, but also really taking this idea that if you actually were to invest millions of dollars into technology to make the work-life balance of nurses better, could you scale that workforce? And that's exactly what we found. And that's what's very exciting is every day I get to go to work and think to myself, how can I make the life of nurses better? Through the access of technology, which, let's be honest, most of us as nurses recognize most of the technology that was given to us as nurses just created more work for us in our lives as opposed to making it better. I spend my entire intersection at how do I actually make that better so that they want to engage and pick up shifts and still be able to have the family they love and a career that they love at the same time.
There's such a disconnect. There's a disconnect between what nurses want and what administrators want. Is there just a misaligning of incentives here? What are some of the other things? And I guess my question to you is is that gap getting any closer? Are we really bridging that gap, or are we still just as far, away?
Well, so it was a great question, Michael. And I think things are worse for the nursing profession than they've been in recent history. I think if you look at the studies, we have 5 million nurses in the United States, but over the last year, we've lost 100,000 nurses, the largest exodus that has ever left the profession. And scarier statistics are showing that even before the pandemic, 57% of new grads had left the bedside practicing within 2 years of practice. We believe that number is as high as 70% currently. But other things that are happening is this retirement of the older workforce that's not staying.
Yeah.
And I think, to tell you the truth, the reality is that healthcare has always just seen nurses as a commodity, a surplus of supply that will always be there. And so they never had to invest in it, right? Healthcare systems didn't have to. They didn't have to provide flexibility or the ability for nurses to have this kind of balance in their life because they thought, oh, there's just always going to be them there. And the reality is it's because nurses are cost to healthcare systems, Mike. And what that means is different than any of the other healthcare professionals that are out there that are billable services. Nurses to healthcare systems are just purely costs. So what that means is that healthcare systems do not invest in costs like any business, right? You're never going to invest in costs. You try to cut costs. And that is what I feel that our healthcare systems have done to nurses. There has never been a reason to invest in them. And the truth is, until we create some kind of ability for a reimbursement model or something such as that, for nurses, there is always going to be this misalignment between the need for more nurses and the ability to pay for them in our current system.
So what you're saying is that when a nurse is delivering care, let's just say, for example, in a hospital, an inpatient stay, and if that patient is a Medicare patient, the facility is being reimbursed a lump sum fee. You're saying within that lump sum fee, is that inclusive of the nurses bedside manner, or are you saying that, okay, so what if someone is so for example, you're a nurse practitioner, you have the capabilities of being able to write scripts and do certain things. At what point do they become, I would say, an asset, a revenue generating
You just nailed it, Michael. Actually, it's being a nurse practitioner, right? So nurse practitioners are reimbursable for their service. They're able to bill for their services. Nurses are rolled into the room rate. And that actually happened way back in the 1900s when nurses became the center of care in hospitals. But if you look at bills from the 1920s, they all billed for their services. They were private individuals. They all ran their own entrepreneurial venture in the 1920s. But hospitals, I hate to say this, at the time were very much just run by men. Physicians were men, and they started to feel that nurses and women started to have too much power. So in the 1930s, when they came up with national insurance models, they looked for a model to pay for nursing, but not recognize nursing as a value add to hospitals. So they turned to hotels. So they thought that maids were rolled into room rates, and they rolled nurses into room rates in the 1930s, forever placing them as a cost to healthcare systems. So you could almost argue, and in fact, it's actually true, that bedpans are worth more than nurses in hospital systems because there's actually a billable code for a bedpan. But nurses are rolled into the room rates as effectively with the linen and the bed in the room. And so there's a whole bunch of money that goes to the room rates, but nothing distinctively for the nurses in that. We're just rolled into that lump sum. Now that's different than everybody else. OT, PT, respiratory therapists, MRI techs, even kitchen, dietitians, all of them have a reimbursable service. And that's why there's never a problem hiring more OTs, PTs, or, MRI staff, but there's always a problem with hiring more nurses.
This is fascinating to me. The fact that a nurse, who in my opinion is the spine of an organization, I mean, nothing really happens until like a nurse delivers some sort of care. So it's just kind of baffling to me. Is this more of a legislative issue, or what, or can this be handled on a local level?
So it's a great question. And honestly, I think it really comes down to Medicare, Medicaid. as being the movers. It has to be a payer decision, but I don't think any independent payer is going to make that move without Medicare and Medicaid doing this. So we launched a commission called the Commission for Nurse Reimbursement just about 6 weeks ago to take on this issue. And one of the things that we're exploring is working with some of the treasurer's offices around the country who have been investigating where has all the money gone that we've been giving to nonprofit healthcare systems. I don't know if you paid attention to what happened in North Carolina with the discovery of $1.75 billion going to executive pay over the course of the last 5 years, doubling of CEO pay in the last 5 years, but nursing salaries over the last 10 years only going up 14%, and primary care physicians still in those nonprofit healthcare systems only up 22%, which is 2.2% per year. A lot of these treasurer's offices are trying to figure out, we're giving you billions of dollars in Medicaid dollars from our states. Why are you not being able to provide this care? So we're talking to treasurer's offices, but really who we want to be talking with is the Center for Medicare and Medicaid Innovation to say, give us a moment, a chance to explore if we can create a reimbursement model, which the commission is working on through a set of economists and academics and chief nurse executives. I don't have our models yet, negotiating a set of those to say, let's try something different. So it is going to take a change in the payment models by payers, probably not legislated. I can't, because that's not traditional for the things, but the organizations like MedPAC and CMMI can make suggestions to change reimbursement models within healthcare. They did this not long ago for occupational therapy and respiratory therapists and all of those. And so we know that the models exist and are very successful.
So what are you hypothesizing here? What do you think? What would happen if this could occur? I mean, theoretically it can, but what do you think?
I think we would actually solve the nursing crisis. And I think the reality is that the McKinsey study showed that compared to 2021 and their 2023 study, which we thought it was terrible in 2021, 1 in 3 bedside nurses were planning to leave the profession. They've actually found in the most recent study an acceleration of nurses feeling worse, higher amounts of them looking to leave than ever before. Because
where do they go, by the way? Where do they go?
So they're leaving the profession almost in its entirety. They're not, some are going back. Our new grads go back to become nurse practitioners, but our other ones that are in the system are going and working at hotels. I mean, there were stories about them becoming truck drivers or going to Starbucks and just doing anything but being a nurse, because what they have literally said is, it's no longer safe for me to practice. You're putting me in environments where there's not enough nurses to deliver care. So either I'm going to make a mistake, or every day I walk home with moral injury, knowing that I haven't been able to deliver the care for the patients in front of me because I don't have enough time to do this. And Michael, I think what's different is everybody's like, oh, they're burned out. It's not burnout. A nurse goes on a 12-hour shift, and we joke that we don't go to the bathroom, that we don't eat. And why we don't go to the bathroom, we don't eat, is not because it's a badge of honor, but it's because if we step away from patient care, somebody could die. Now that doesn't exist for you and me, right? If we go to the bathroom, we may miss a phone call, or we may miss an urgent call from our CEO, right? But the reality is somebody isn't going to die. And that is the level of intensity nurses are dealing with. And now that they've started criminally prosecuting nurses in the Redonda Vought case, and then the 100 nurses and CNAs who've been prosecuted criminally across the state of Ohio in nursing homes, but no nursing home leader, the reality is the stakes have gotten very high. And nurses are saying, I no longer can be a nurse because you're putting me in unsafe situations. And now you're making me choose between the love I have for my family, the love I have for my profession, and if it is safe for me to practice. And when it's no longer safe for me to practice, I have to leave. And that to me is where we are in healthcare. And if we pass this reform, there will no longer be that misalignment. More nurses will equal more cost, but with an associated revenue line. So hospitals won't feel the need that when their operating budgets are being squeezed to staff nurses to the lowest cost denominator, which is what they do every single day today.
And do you feel like in order for that to happen, the way to kind of plug this is by being flexible, by offering nurses and innovating, by saying, hey, in this gig economy, you can actually have more control over what you do by being able to actually pick and choose where you work, when you work. How does that impact consistency of care? Does that translate into better or worse, same outcomes?
So that's a brilliant question. So absolutely continuity of care is important. And I know I work for a staffing agency, and when I joined, I knew directly that the industry of staffing does three things very well. It's a higher cost, sending worse quality with worse outcomes for patients. All the studies show it. So the reason I joined this company was not only to change the future of work for nursing, just as what you said, which we found true, which is we thought nurses would work one shift a month with us. We make it so easy to pick up shifts that when you give them an Uber-like app, it's raining Saturday, kids' games are canceled, they can go to work. Guess what? They pick up 5 shifts a month with us as opposed to 1. But the issue to what you're saying is this continuity of care. But what we're finding across care settings, let me give you an example. Mayo opposed a bill, a bipartisan bill that went to the governor's desk in Minnesota just 5 weeks ago, that basically was saying keep nurses at the bedside act. That was what it was called. And it was about putting together committees that would have nurses identify how many nurses per patient per floor based on acuity levels. Mayo opposed it because they said, if you pass this, the reality is we don't think we have enough nurses in the state of Minnesota to do this, because 56% of nurses in Minnesota work part-time. It is the reality of care today. The vast majority of nurses in this country are no longer working full-time. So the reality is that we have to start accepting that we have no longer a workforce who is going to be there every single day. So we have to optimize, upskill, and provide the trainings and the certifications necessary to a gig-like workforce to be successful. Because it's not only gig workers walking into this environment that are not having the support or the continuity of care, but it is many of these are healthcare systems who are dealing with the vast majority of their nurses wanting or are working in that capacity. So continuity of care has already been something that has been disrupted, not by the making of the gig economy, but just by the nature of the workforce that exists today in nursing.
So let's just say we fast forward a year from now and we're chilling, doing a virtual coffee, and we're looking back. What needs to happen in order for you to feel satisfied with the progress of nursing, with the progress of innovation?
So what I hope, and I was just listening to somebody from HRSA speaking, and they said because of the debt limit, nursing conversation got reorganized at the federal level. But the truth is we as a country don't come together to figure out ways of solving the nursing crisis and shortage, keeping more nurses at the bedside, providing them with technology that allows them to do so, providing a safer environment for them to work. The reality is healthcare is going to only get worse. And what that means for you and I is that patients, when we go to a hospital system, the emergency room that we used to be able to be seen in 3 hours is now going to be a wait of 18 hours. The truth is when we try to access care, we're going to be denied access to care because we're going to be told there's not a floor open to take us. And what that means is that's going to hit us at the worst moment of our lives, because nurses are there to be that person when nobody else can. And that is what we need. And the truth is if we don't take radical action, and what I'm not saying is radical from, okay, give millions of dollars to produce more nurses. We have plenty of nurses. In fact, we have 5 million nurses in the United States, more than we've ever had before in history. What we have is a shortage of nurses willing to work in healthcare environments as they are today. And that is something we can change. When we decide to commit to safe ratios for our nurses to care for, they come back. When we commit to providing nurses with access to shifts that are not based on simple hierarchy or financial rewards, but allows them the flexibility to work, they come back. And the truth is we cannot continue to come at this problem through how we've done it. The status quo is failing and failing faster than ever before. So we must start opening up our minds to new ways of engaging with this workforce who we simply are not listening to. And the truth is they have other options. Women do not have to be nurses today. They can choose something else with far less risk to themselves and their family than nursing requires of them. And we have to change that, because honestly, Michael, where in the world would we be without nurses? I don't know where our society would be. I don't know where healthcare would be. And the truth is I can't imagine a world without it. And this is why I'm so excited to talk to you, because sometimes I feel like I stand in an abyss yelling to say, we need to do something for nursing. to save this. And for a long time, nobody heard us but ourselves. So it's just really appreciative that you're taking the
Yeah,
time
of
to
course.
amplify this. So thank you.
It's my pleasure. How can, well, two questions. Number one is, how can people follow your work? How can people follow what IntelyCare is doing, the shifts that you're making? Give you a little kind of plug around that.
Well, you're so right. But I mean, please connect with me on LinkedIn. But obviously, IntelyCare has a massive social following also on all of our social platforms. You can follow them. I mean, honestly, we are going to be doing a lot more webinars and engagement. And in fact, the reason being is we want to start having this national conversation. So if people want to engage with us on the gig economy, if they want to challenge us on staffing, if they want to challenge me on quality, I want to talk to them. Because the truth is that I don't think we're going to get better unless private-public partnerships come together to solve the issues of what's going on in healthcare. And that's where I sit. So I am open to whatever criticism or constructive feedback or discussion people want to have, because it is going to take brilliant people to come together to solve this crisis. And so please engage with us on LinkedIn or in other platforms, and happy to have any conversation at any time.
Absolutely, absolutely. So just kind of one final question is from our community, if you had one ask, what would that ask be? And if there's one take that someone can take from this conversation, what would that one take be that they can take action on?
So, Michael, I know you have a lot of healthcare influencers who listen to what you're doing. And if they could start backing up the conversation that it's time to not have nurses be a cost to healthcare systems, provide a financial model that works for nursing to sustain nursing, would be the ask that I have on them. And if they want to find out more about that, they can go to the commissionfornursereimbursement.com, learn about that, get involved in us, because this is going to be the fight of our careers. Those that have signed up for this feel that this is the only, everything else is lipstick on pigs and band-aids on gorges. Until we fix the financial model around nursing, which is missing today, there is no ability to truly solve this nursing crisis. So that would be my ask.
Well, you certainly delivered lots and lots of passion. I can only say that for those that have been listening, if you found this content helpful for you, would you mind sharing it on social media? Would you mind promoting it? Would you mind even just commenting? I think I'm very grateful because it makes a difference. And my whole entire life motto has always been this: you're one relationship away from changing the trajectory of your future. Maybe that one particular person that has the ability to influence, open a door, to have a seat at a table. That's really what it comes down to. And I know that we have many of those within our community. And I purposely say it, not audience, it's a community, because a community of doers that are attempting to innovate and provide value for many and doing it over long stretches of time. Anything is possible. I know that what you displayed can be perceived as a dim view. In my opinion, it's the reality that we face, and we have a choice to make. We either can go about trying to do better and fix it, or we can just kind of continue to be doing the same thing over and over and over again and just expecting different results. And we know that that's not really a viable option. So Rebecca, it's been a pleasure. It's been so awesome to have you on the show, and open invite to come back onto the show and share progress and share what's happening.
I'd love
So
to,
thank
Michael.
you.
We'll keep you posted. Thank you for having me.